Hi, my name is Lanita Williams, and I am the Patient Care Manager on the Postpartum Unit.
Hi, I'm Susan Oyola. I'm a nurse practitioner with cardiac surgery.
My name is Rosalind Asamoah. I am a regulatory clinical specialist.
My name is Raquel Parces, and I work in a surgical oncology unit for E.
My name is Michael Clark, and I'm the Vice President for Nursing Excellence and Organizational Transformation, which is a mouthful. I found that getting certified is a really good way to make sure that you are continuing your professional development.
Hospital Center also has, through the work of the Professional Practice Committee, they offer continuing medical educations that are free for nurses.
For a surgical oncology nurse, you have to be chemo qualified, but also you have to have other competencies. Most importantly, I would say, is central lines, Metaports, because that's a way how we give chemo to our patients.
I chose to do the acute care nurse practitioner track. When you go back to school, you have many options.
I have a certification in infection prevention, CIC. I also have a certification in healthcare quality.
I would encourage everyone to join the association within your specialty. That allowed me to keep current on all of the different practices and evidence-based changes that went on.
Studying for the CPHQ, which is a certification for healthcare quality, and I am recently certified.
One of the big decisions if you want to be a nurse practitioner is to decide between primary care or acute care.
I was able to, through the hospital, get my certification in electronic fetal monitoring, which definitely helps you as a clinician at the bedside.
You know, these two certifications have really helped me to be able to contribute towards my current position.
Most days, in most places now, if you want to be working in a hospital as a nurse practitioner, you need to go the acute care track.
I gained my certification in nursing professional development and also as being a board certified nurse executive.
Mentoring some of my new nurses that have come along, they're able to use their excellent skills from service recovery. They've been a waitress before.
Having knowledge of drains, chest tubes, colostomies, ileostomies, Melancotte drains is a lot of variety of drains that we have to have knowledge of and how to work with these drains.
In addition to finishing the degree itself, you also need to pass your boards at the end of your program. Taking your boards is almost its own thing, separate from your schooling. Your schooling prepares you to be here working, but it doesn't always focus on the way that the test is done, and you kind of need to have some extra guidance on how to do that.
Not only to obtain the certification at first, but also to maintain it requires, following up every year and making sure that you're actually doing learning activities to support the certifications going forward.
The best part of my job is there are a lot of things that I love about my job.
When I go into a patient's room and she has a smile on her face and her support person has a smile on their face and they give kudos and praise to our staff.
My ability to influence nursing practice and make the practice environment for nurses better.
The people that I work with, we have a close relationship.
I have the privilege really of working on a wonderful team.
The team culture in my department.
You have the opportunity to change people's lives, the way you treat them.
Seeing people heal and go home and do better.
Every single day, the thing that I love coming to work to do is to figure out how do I make the life of the nurse easier and how do I make the practice environment just much better for the nurse.